Turn attention now to another matter, this time health. It's day 3 actually of the warning strike by the National Association of Nigerian Nurses and Midwives following the expiration of a 15-day ultimatum issued to the federal government. At the National Hospital in Abuja, doctors have stepped in to care for patients in wards and private rooms. But the absence of nurses is reportedly being felt, with some patients calling on the association to consider dialogue with the government. The appeal comes after the Minister of Labor and Employment asked the union to allow more time for their demands to be addressed. But the union leaders insist the strike is a necessary move to demand for overdue entitlements and to protest against years of neglect by the government. Although services have not been completely shut down, patients are growing increasingly worried that a prolonged strike may put lives at risk. The National Secretary, Federal Health Institutions, Nurses and Midwives, Nurses Osinachi Enya joins me at this time. Good to have you on this time. You know, greatly Nigerians sympathize with you, with members of your union, over what you're facing and what you're talking about at this time. But it's taking a toll on patients, and the patients themselves are appealing to you to consider them. How do you react to their plea?
Okay, thank you and good afternoon. Honestly, it's not like we are too happy over what is happening now. We are really very, very sorry. But at a point like this, we'll have no option because some of the issues have lingered for over 40 years. A baby that was born 40 years ago by now should have a child or maybe graduated from university and have something meaningful doing with his or her life, okay? If government has did their own part, we will not have this kind of issue coming up. We are really, really sorry for doing this, but at a time like this, we don't have any option. Thank you.
And government also is appealing for dialogue. Are you open to dialogue with government? How are you approaching this? Because strike usually should be the last resort, but have you really explored all of the options?
Like I said initially, that some of these issues have lingered, lasted for the past 40 years, okay? And we've tried engaging them into dialogue with us, and a lot of people have even stepped in, but you know now, they will say one thing and at the end, they will do another thing, and some of the things that even they will put on paper is even so annoying, okay? We've tried other means, and as it sounds like this, our patience level is at 0%.
But considering that this is a new administration, just about 2 years in, are you willing to, just really allow them? I mean, they're calling for meetings, just sit at the table with them, try to hear what they're saying and see what they're proposing at this time. If perhaps it would, assuage your anger over these matters.
Okay, we are open for dialogue. If they say let's dialogue with them and they make themselves available, we're open to dialogue. We'll meet with them, we'll discuss, but then it's not going to be business as usual. Like they will come and tell us one thing just to, ease our pains. And then when it comes to implementation, we'll not hear from them again. No, what we want this time around is if they said they want to dialogue with us, we are available. And then if they said they're going to do this, let them do it and let there be a time frame. Thank you.
But the thing with the dialogue is that when you come to the table with government or any other body that you're dialoguing with, it has to do with trying to reach a middle ground. It means that somehow the nurses and midwives would also be willing to maybe take a step back and just try to reach an agreement with government. Is that something you're willing to do, or are you just bent on having all that you have listed acted upon?
No, we're not saying that's all that we've listed.
National Secretary, Federal Health Institutions, Nurses and Midwives, Osinachi Enya, thank you for your time on TVC News.